Okay, so today we're going to talk about burns. Now, burns are really high risk in children under the age of 4 because basically because they're so young, you've got to remember that babies and very young children have no fear. And the reason they have no fear is because it's kind of an evolutionary thing. If they had fear, they would never try anything. They would never try to walk, run. Every time they fell down, they wouldn't get back up again because they'd be worried that they might hurt themselves. So children are specifically made like that so that they don't have any fear at all. So when it comes to burns, and all sorts of other things like drowning, poisoning, all these other things, they are more at risk under the age of 4 because they have no fear and they're very, very curious, but also over the age of 1, they're usually very mobile as well. So this age group, we really, really have to watch out for. Every winter, there is a Burns Awareness Month, and that's because burns go up about 40% in the winter time in Australia, and it's probably due to the fact that we're inside more and more hot drinks. There's very much in the Western world we very much have a coffee culture now, and everyone's carrying a boiling hot drink around their children, which we all do, but it just means that there's always something around that's a potential danger. So we're just going to go through a few of the essential first aid bits today of what we need to do in a burn. So burns are high risk for babies and children, especially under the age of 4, which is what we've just talked about, because they have increased mobility and natural curiosity. And 50% of burns are from hot liquids, which is not a surprise. There are other types of burns like inhalation, radiation, and these kind of things. But burns are extremely serious and can be life-threatening for a baby and child. So what we need to do with the burn is we need to run it under cold water for at least 20 minutes. And if it's a part of the body like the face where we can't get it under the water, then we need to fill a bath or a sink full of cold water, pop in lots of different like flannels, towels, or anything you can, so that we can just alternate onto that area, okay, to make sure it stays nice and cold. If the burn is stuck to clothes, we absolutely do not remove the clothes. If a child has jewelry on, we do not remove the clothes from that area. We don't pull it off the skin. It's very important that we take, if a burn is sustained through liquid, it is super important that we take the child's clothes and nappy off, because think what nappies are made for. They hold water, and we've seen so many awful scenarios where children are very burnt in their nappy area because that boiling water ran into the nappy and just got held there and burnt them. So we must get our children undressed when they've sustained a burn, especially from scalds, from hot water. But if a burn is stuck to a piece of clothing, then we don't remove that from that part of the burn, okay, because that needs to be done under medical guidance. If a child has burnt their airway, so if they've drunk a really hot drink, we need to get them checked, because airways can swell. Any burn can swell, which is why we also need to remove jewelry, but especially in the airway, because we can't see it. Obviously, if it swells, it's then a risk to their breathing. What we don't want to do is give them cold water or cold drink, because that can actually they might not be able to swallow properly because of the burn, and then it's gone down the wrong way, and actually it's not going to help, because it's just, if they do swallow properly, it's actually just going straight down into the tummy. It's not actually sitting on the burn like the cold water. If the child is acting differently, in shock, or they don't cry straight away or anything like that, then you need to get them seen straight away. If the burn is on the face, hands, genitals, or feet, then we definitely need to get them checked, because burns can cause scarring after the event, and we don't want these areas to have reduced movement or be affected by scar tissue. Once you've run the burn under cold water for 20 minutes, you then need some kind of clean, dry dressing or cling film. Honestly, I would go straight for the cling film, and you want to cover that burn with cling film until you go and get medical help. So the reason we use cling film is because you can see through cling film, you can see what's happening with the burn. It stops the oxygen getting to the burn, so that then it's slightly less painful at that time, but also it will stop bugs getting to the burn as well, but also it won't stick. So it's got a lot of different reasons why we use cling film. When we put a dressing on, it may stick, and then we've got some trauma at the other end trying to get that dressing off. Even though we're going to place that on for some first aid after we've run it under cold water for 20 minutes, we still need to get help within that hour of applying the cling film, okay? So we need to make sure that burn is dealt with. As a rule of thumb, over 3 centimeters, a burn should definitely be seen, but any burn that you're worried about needs to be seen by a doctor or an emergency department. We don't need to put ice on a burn. It's too much. There's no need. Some children, when they have a burn, might go into shock, and actually the ice and cold water just makes it worse. It can drop their temperature. They get very shock is actually, you know, a medical term for what happens in the body. They can sometimes have a fluid shift and actually get very sick with shock with a major burn. So what we need to remember is to get the medical help straight away, and definitely do not apply any of your own creams or ointments, because they can actually trap the heat in a burn. So your doctor might give you burn cream, that's fine, that's completely different, but do not put your own burn or your own cream onto a burn until it's been seen by a doctor, okay? The doctors and GPs are normally very, very good at treating burns. So if it is a minor burn, your GP should be absolutely fine. But if your child is acting out of the ordinary, or the burn is bigger than 3 centimeters, definitely get seen by the hospital, okay? So I hope that's been a bit helpful today. If you have any questions, you know where we are. We now have our online first aid classes where we talk more about burns and heaps of other things: febrile convulsions, fever, infant and child CPR, head injuries, drowning, poisoning, all sorts. Choking obviously is a big topic. So have a look at thenestcpr.com and you can find all of our bits and free resources there. Okay, take care. Bye-bye.